Today we'll be talking about ocular injuries. Before we go into the topic proper, there are few terminologies under ocular trauma that one needs to be familiar with. First and foremost is the concept of eye wall. Now what exactly forms the eye wall? The eye wall is formed by two layers, the cornea and the sclera. Cornea forms the anterior 1/5 and the sclera forms the posterior part of the fibrous coat of the eye. So cornea and sclera together form the eye wall. Now in case of ocular injuries, if there is a breach or a break in the eye wall, then we call it as a open globe injury. And post-trauma, if the eye wall is intact, then we call it a closed globe injury. So this is the broadest form of classifying ocular injuries. Closed globe injuries are again of the following types. We have a contusion and the lamellar laceration. What exactly is contusion? Contusion is a closed globe injury which occurs from any form of blunt trauma. What is lamellar laceration? It is a closed globe injury which is characterized by a partial thickness wound of the eye wall caused by a sharp object or a blunt trauma. Now here we see the term partial thickness. This is very important because if it is a full thickness wound, then it becomes an open globe injury. So this is a partial thickness wound, so it still comes under closed globe injuries. So under closed globe injuries, you have contusion and lamellar laceration. Open globe injuries has the following three types. First one is rupture. Rupture is basically a full thickness wound of the eye wall which is caused by blunt trauma. Next is laceration, which is a full thickness wound of the eye wall which is caused by a sharp object. It can be of the following two types. It can be a penetrating type of laceration or a perforating type. What is a penetrating type of laceration? It is something where there is a wound of entry but there is no wound of exit. There is a perforating injury is one where there is a wound of entry as well as a wound of exit. Next one is the intraocular foreign body injury, where there will be a full thickness injury to the eye wall and there will also be a intraocular foreign body. So these are the different types of open globe injuries: the rupture, laceration and intraocular foreign body injury. Before we go into blunt trauma, there is another concept of an extraocular foreign body which we need to know. What exactly is an extraocular foreign body? Like you have an intraocular foreign body where the foreign body penetrates the eye wall and enters the eye. Sometimes some common foreign bodies can be lodged somewhere on the surface of the eye itself. So these are what we call as extraocular foreign bodies. What are the common sites for these extraocular foreign bodies? They can be commonly seen around sulcus subtarsalis. They can be seen in the conjunctival fornix, or they can also be seen on the bulbar conjunctiva. These are the sites on the conjunctiva. The fornix is basically a junction between your palpebral and your bulbar conjunctiva. So here we can see here there is a small foreign body in the first picture in the palpebral conjunctiva. Here you can see one small foreign body on the bulbar conjunctiva. On the cornea, we can see it on the corneal epithelium, superficial, or it can go a little deeper into the deep stroma. So here, third picture, you can see a small foreign body on the corneal surface. So what are the common extraocular foreign bodies that we can see? Okay, they are most commonly seen in industrial and agricultural workers. So industrial workers, mostly what we see are particles of iron, usually with hammer and chisel work. So pieces of iron can just come and lodge themselves on the surface of the eye. Agricultural workers, usually we see husk of paddy and wings of insects. The other extraocular foreign bodies which we can see are dust, sand, glass and wood. So these are different types of extraocular foreign bodies. What are the symptoms that a patient with an extraocular foreign body come to you with? He'll most commonly have pain, watering, redness, photophobia and decreased vision because of excessive watering, and if the foreign body is right at the center, that can also affect the vision of the patient. Patient will have some amount of blepharospasm, which is a forceful blinking because the foreign body is causing so much of discomfort. We can also have some amount of conjunctival congestion, and when we examine the patient on a slit lamp, we will see a small foreign body. So the foreign body has to be removed. So how do we treat the extraocular foreign body? It has to be removed from the eye. Now, how do we remove it? That again depends upon where the foreign body is lodged. If it's on the conjunctiva, it's a different mode of treatment. Corneal foreign body is managed in a different way. Whenever you have a foreign body, it has to be removed under the slit lamp. A slit lamp is a machine with which we can magnify the image of the eye and have a proper look at the foreign body, and we can remove it. Now before we remove the foreign body, we have to instill a topical anesthetic. The most common anesthetic that we use is the Paracaine. So once we instill Paracaine, we place the patient's head on the chin rest of the slit lamp, and if it's a conjunctival foreign body, we can just use a cotton swab or a cotton bud and just remove the foreign body. If it is a corneal foreign body, it is not that simple. It goes a little deeper, so it doesn't come off with a cotton swab. So we need a 26 gauge needle, okay, and we need to remove the foreign body completely. Sometimes the foreign body can penetrate a little deeper, so you have to scrape the edges of the defect as well, so that the foreign body is completely removed. Once the foreign body has been removed, you start the patient on topical antibiotics and ask the patient to follow up after a period of 1 week. So this is how we manage a extraocular foreign body.